So James, as I said in my comments earlier, one of the issues that came out in our community poll survey is that the community as a whole is really concerned about basic healthcare and their ability to access basic health services now and into the future. But as I said, they see the model of service provision as still being predominantly driven by the public sector. So more public hospitals, basically. I should have mentioned that James also contributed to the report, and when you go through his comments, the things that you pick up on are that the system's fragmented, siloed, we don't share data, funding is not is activity-driven, not outcome-driven. How do we get to a better place?
Yeah, it's I guess it's important before we say what we're going to do to kind of recognise that we kind of have to do something, because it's such a big sector. Health and aged care and disability and the human services together, it's a massive part of the economy, and it's a growing part of the economy. As our economy matures, we spend a lot more on these kind of services, and as we grow older, we spend a lot more on these kind of services, and as we tackle greater issues like chronic illness and mental health, we spend a lot more on these services. And so we spend a lot now, and I guess the numbers we've done projecting the future, if we don't change the way we work, get horrifyingly large quite quickly. And that means a lot more cost for people ultimately, either directly or through the taxation system. So what do we do about it? I guess there's been a lot of reports that have looked at the health and these other sectors, and they've all come to similar kind of conclusions, that we tend to be focused very much at the acute end of the problem. Hospitals and the services around, delivering, curing illness, the medical model of that, and when you look at the economics of it, it's so much more sensible, both in outcomes for people but also cost efficiency, to look at prevention and early intervention. But not only that, looking at models where people can live in their communities and get the services they need, often away from a very acute setting. And so partly it's that shift from much greater investment in prevention and early intervention and community-based care, but also along the whole chain, thinking about the citizen and looking from their perspective and measuring what they value, rather than, we've got a very system-centric view at the moment, in particular a medical-centric view. And so we really began looking at those sort of things, and it has to be acknowledged that it's very hard to change, because the political economy of these systems make them quite difficult to change. There's a lot of vested interests in the present. There's a lot of political sensitivities around all of these issues, and so then it's not simple to change. We suggested a good avenue of change was place-based innovation for a whole lot of reasons.
I'll come back to place-based in a minute. It is interesting though, when I was talking at a conference on stage about data and using data better in the health system, and using some examples that I'd seen overseas. And the person I was talking to was a professor, and he just said, yeah, but they're the same two examples I hear all the time. And it was like, oh, okay, so there's really only a couple of places that have been able to really drive systemic change and do the sorts of things that we're talking about. So we'll come back to some ways you might sort of find to drive change at a smaller scale, I think. Melina, one of the things that you obviously believe really passionately about, and that comes through all of your comments and written work, is the role of mutuals and cooperatives in being able to drive different models of service delivery, and to basically drive new forms of service delivery and better care for customers and patients and clients. Can you talk a little bit more about that, and what is it about that sector that enables it to do that, and what are some of the barriers that get in the way?
Well, to start with, I think I really like James' analysis, which is that you start by thinking about what you're trying to achieve. You know, what is the shared objective? If it's better health or holistic health that's based on wellness rather than dealing with the acute and expensive end of the medical health chain, then that's a great way to think about what different operating models and business models can do in areas like aged care and disability and health. Cooperatives and mutuals are sometimes thought about in terms of enlightened self-interest. And if we think about our self-interest in relation to our desires around health outcomes, we can start with ourselves. When I think about ageing, I think about what that's going to look like for me. If I'm older and living with dementia, what kind of care do I want around me as an individual? I want well-trained, vocationally orientated carers. A consistent carer would probably be a good thing. I want to know that it's reliable and affordable. It doesn't surprise me that Australians still look to the public health system. It's part of our narrative, perhaps around egalitarianism, that there but for fortune we should all be able to receive affordable medical services. And this is a way of thinking about what you can do if you really look at the operating model. With a cooperative or mutual, you're able to align, or it is possible to align the interests of the different stakeholders. So if you think of the consumer and the worker, a worker in the aged or healthcare system would probably also want more or less the same things as the consumer. The desire to be well trained, to have consistent work, to be vocationally motivated, including through a wage that reflects the work that they do, or that they can sustain their own, their own life on the wage that they receive. What you're trying to do in an operating model is bring those different stakeholders together and align them so that you get the most efficient model of delivery. And the way that was traditionally done, and is again emerging as a new force in these different areas, is through communities coming together and combining their self-interest. That can also be a way perhaps of dealing with the difficulties of looking at the funding models of this going forward. Mutuals, if you think before the welfare state, mutuals, friendly societies and the like, Australian Unity, brought community stakeholders came together, they had shared outcomes such as the delivery of an affordable local healthcare system or pension system for widows and orphans, education, etc., and worked out as a community how they were going to fund that through cross-subsidisation, pooling risk and sharing the reward of that pooled risk. We need to be able to think about doing that in terms of now our personalised budgets. Atomised budgets of health, disability or aged care can be a wonderful opportunity for choice and control. But in markets where that atomised budget is not effective, you do need to think about how you can cooperate with other budget holders and with workforce in order to deliver the same quality and perhaps improved quality of services that you want around your own needs. And that's what's starting to happen with cooperatives formed of budget holders, for example, or workers coming together and deciding that they want to try and mediate the market by teaming up so they can scale as small place-based solutions into the larger markets in order to deliver disability care. There are still some impediments around being mutuals, and they largely have to do with access to capital. And that's something we need to deal with in a legislative and regulatory sense. That's one of the roles of a the councils to try and create a more enabling environment.
Thanks, Melina. I should just be upfront about one thing. Melina mentioned Australian Unity, which is, of course, a mutual organisation, 178 years old, which I know well because I sit on their board. So in the spirit of transparency, that's where that slight reference came from. Melina, one of the things you talked about, you used the word efficient. And I think one of the things that we struggle with in some of these conversations, and when you start talking about new models of service delivery, is language that sometimes people think sits uncomfortably in the health space or the aged care or the disability. Basically, when you've got vulnerable clients and customers, when we start talking about, well, efficiency and operability and profitability and all of these things, how do you frame that from the perspective of cooperatives? And because, of course, one of the things that, in order to deliver services consistently, you do need to be financially sustainable. So how are you seeing that play out? And I mean, perhaps you might want to talk about NDIS as an example, or other areas where you see the role of cooperatives and how that plays out differently.
Well, like any form of social enterprise or business model, you have to make a profit or a surplus to be sustainable. You must be able to cover your operating costs, make enough money to reinvest in the business and innovate, and to increasingly in health and disability care to attract a motivated, consistent workforce, which is one of the startling statistics in James's article was around the current sort of metrics, the unattainability going forward of having 4 million older people by 2050 and being able to provide a workforce of 1 million people or so. So I guess from a cooperative or mutual point of view, it's what you do with the surplus that is really important. We need investment in social infrastructure, and what you don't want to happen in an efficient, from an efficiency point of view, is to have any of that surplus sucked away from reinvestment in the infrastructure itself. So I would posit that there are some operational models, cooperatives and mutuals being one of those, that in some markets the ability to reinvest all surplus back into the business, or as it's commonly referred to in cooperatives and mutuals, the benefit of the member, the stakeholder, which can be the workforce, the consumer, or a provider, or any combination of those. That's really, I guess, the bit that's about combining the commercial business purpose and the social objectives of the business in a way that allows you to attain or to optimise your productivity and your efficiency from the point of view of the stakeholders.
Okay, thanks. I won't let you off the hook. I know that you mentioned place-based as well, so we'll come back on that. But Rob, lest you get bored sitting there, let's talk quickly.
I just didn't like the way when Melina said when she thinks of ageing, she looked at me.
She did. I thought she was glancing my way. Crime, justice, these are issues that have been writ large in the Victorian dialogue recently. They certainly played out in the context of the election. I think, again, as I talked earlier about our own survey work, crime and safety and community in your own homes and things like that is certainly something that people are worried about. But again, the solutions they're looking for in terms of tougher sentencing, more policing, all of those kinds of things are probably not the solutions that are going to deliver the best outcomes in the long run. And I talked earlier just, around some of the statistics around just more and more people going into prisons, recidivism on the rise, the increasing cost and the increasing investment, and it just seems to be this kind of vicious circle, really. So what does smart justice or smarter justice look like from your perspective?
Well, you can be as sure as you can night following day that around election time you'll have politicians standing on the front steps of Parliament House with their law and order baseball bat in their hand, and they'll say, "Vote for me because mine's bigger than yours." And it happens every election time, and it's one of those policy areas where often policy is made despite the evidence. All the evidence shows that this tougher on crime approach, this lock 'em up, throw away the key mentality just doesn't work. And it's not just me saying that. You've got the Ombudsman produced a report 2 years ago in relation to this, where she made it quite clear that if we keep going down the path we're going, we'll end up spending more money on prison beds than hospital beds or school classrooms. Our women's prison, for instance, and we have a bit to do with our female prisoners as a result of the multidisciplinary practice that we've set up at RMIT, figures show that 80% of women in our jails themselves have been victims of family violence or sexual assault. 80%. And yet we're locking them away. We have in our jails right across Victoria, 44% of men and 33% of women have an acquired brain injury, compared to 1% in the general population. I mean, the bottom line is our prisons are 21st century asylums. Like that's the reality. And in the Corrections Act, which basically sets up our correction system, there's virtually no mention of rehabilitation. It's not one of the purposes of the Act, nor is reducing recidivism one of the purposes of the Act. It's all about containment. So we just have to think differently in relation to our justice system. When I was Attorney General, I had this pretty simple philosophy, a bit like me, pretty simple, and that was that people's lives will go along a certain track like that, and they might have their ups, they might get married or win Tats Lotto or whatever. They might have their downs, there could be a death in the family or whatever. And as a result of some of those down times, they can come into contact with the justice system. There could be mental health issues, long-term unemployment issues, homelessness issues, drug and alcohol issues, and they touch the justice system. I took the view that at that point in their life when they touch the justice system should try and act as a bit of a trampoline to bounce their lives back on track, to be a positive intervention in their lives. And that's why I introduced a whole lot of specialist courts, the Curry courts, mental health court, family violence court, and the like. But unfortunately, the debate we saw, particularly in the lead up to the last election, was as bad a law and order debate as I've seen. But the good aspect of the outcome of the election is hopefully people are coming to understand that this full-on law and order, tough, more jails, more prison beds, doesn't really work. And hopefully the outcome of the recent election will lead to more understanding about what the research shows, and looking at addressing the underlying causes of why people come into contact with the justice system. And you said smart justice, and your report touches on it pretty well. Looking at much smarter ways of, if you like, making the community safe and selling that message to the community. Holistic approaches work. Someone will come into contact with the justice system because they've committed an offence. They've committed that offence as a result of drug and alcohol addiction, and that's because of mental health issues, and that's because of long-term unemployment issues, and that's because of homelessness issues. Unless we address all those issues in a holistic way, we'll just create this revolving prison door where people go in and out of prison, doesn't make us safer as a community, and we end up, as I said, the Ombudsman has said, spending more money on prison beds than hospital beds.
Now I'm going to turn over to questions. So if you have a question, please raise your hand and someone will scoot over with a microphone. And then if you could introduce yourself and direct your question, that would be great. And while people are warming themselves up to raise their hands, I'm just going to come back on this comment about the sort of holistic approach. And some of you in the audience, if you may have heard me give this example before, but there's an example of a place-based program in New South Wales, which I keep talking about because it seems so simple that I hope if I keep talking about it, maybe more people will latch onto it. But it's a holistic approach, it's a place-based approach, but it's also one that involves collaboration across sectors, where the community from Bourke, very large Aboriginal population there, actually approached a bunch of unusual suspects, if you like, to partner with them, including some large businesses, to try to figure out how they could address their problems with youth and the youth justice system, and basically their kids ending up in jail, and their kids were just way overrepresented in detention and in prisons. And the interesting thing was that the solutions weren't that difficult. So these kids were ending up in trouble because they were driving without licences and they were mucking around basically on the weekends. And it took some people to sort of go in and get some information. So I think when business ponied up and said, yes, we'll help you out, one of the things that it also did was force government to actually have to sit up a bit straighter. Because here was a peer, if you like, that was going to demand that they present information and evidence on things. And so then the evidence kind of started coming forward, and it was things like, yeah, they had youth workers, but the youth workers finished at 4 o'clock on Friday night. Yeah, they had a youth centre, but the youth centre wasn't open on the weekends, which of course coincidentally is when the kids were getting into trouble all the time. And yeah, they had 1 or 2 people who could teach the kids how to drive, but really not enough people. And so it was all these just really simple things. And first of all, it's really surprising that you end up getting locked up for these things, which is interesting in itself. But second, that the solutions were not that hard. But it really did require a disadvantaged community to form a relationship with someone that government would take seriously before they got the answers. And the other thing that happened was that the New South Wales government, to their credit, fronted data into the equation. And when I say data, what I mean is that they told the community how many programs they had there, which ran into the dozens, and how much money they were spending, which ran into the millions and tens of millions. And the point of that is that what they did by giving that data over, sharing that information, was that they allowed the community to know what the size of the prize was. So the community knew that if they did something different, they could actually then put a dollar figure on how much money they were saving. So, Rob, to that point, I mean, I was really staggered to see that around 50% of prisoners in Victoria come from around 6% of postcodes. So just 6% of all of the postcodes in Victoria are so disadvantaged in themselves, and they produce 50% of the prison population. So how do we tackle that?
Well, place-based, as in Burke, I mean, it's known as justice reinvestment, basically, in the States, where I think in Texas, the governor at the time, Jeb Bush, Conservative governor, decided that the state was going to go broke unless it actually looked at smarter ways of delivering a justice system that can turn people's lives around but not spend so much on incarceration. So he said to his bureaucrats, we're not going to continue to build more and more prisons. We want that money that was going to go into prisons to go into early intervention programs, to go into after home care, school programs and the like. And they were able to reinvest that money, and as a result, ended up closing 3 prisons in Texas. So justice reinvestment actually works. It works. It's just a matter of thinking outside this. I mean, that example you've given in Burke, for instance, I know a bit about it, and yeah, a lot of these kids were going to jail because they were driving without a licence. Well, hello, let's actually teach them to drive and get them licences. They were driving long distances to see family and friends. There was no public transport. How else are they going to get there? They're not going to ride a bike for 100 k's. But instead, we lock them up because they haven't got a licence. Like, this ain't, you know, you don't need to be a Rhodes Scholar to work out some of these pretty simple solutions. I mean, as I said before lunch, some of the way we've designed our justice system, seriously, if there was a TripAdvisor for the justice system, it'd get no stars. It'd get no, like, anyone here been to court recently and just had a look? I'm not asking if you've been charged with it. Just had a look at the way the court operates. Like, if you were told by your doctor that you had an appointment at 10 o'clock, and so, you know, you get to your doctor's at 10 and the doctor doesn't see you till 4, you'd be reporting the doctor to the AMA. This is happening in our courts on a daily basis. They are just so antiquated. And that leads to frustration. Like, some of the frustration you see at our local courts build up, people queuing up for half an hour to get into court. They're queuing up with a witness, a perpetrator, and then by the time they finally get into court, you know, their hair's standing on end, and their matter's not hurt until 4 o'clock in the afternoon. And they've got kids running around. Like it's a badly designed system that needs total rethinking from a user design perspective. That is, from the customer perspective. What do the customer expect when they go to court? They want to get good service, and they want it to be efficient. We're not delivering that.
Yeah. Now, questions? We've got, one here and then one here.
Hi, Ben Harris from the Australian Health Policy Collaboration at Victoria University. Rob, I think you also need to go to hospital outpatients for the 10 o'clock appointment, see how you go there. We do a thing called Australia's Health Tracker, where we look at Australia's health tracker by area, by socioeconomic status for mental health. We also work with the City of Brimbank on looking at place-based approaches. You spoke about, James, you spoke about what consumers valued. Melina, you spoke about personalised budgets, and you've each spoken about place-based. To me, the question is, who's actually defining what people need? How do we shift from a patronising, condescending set of siloed systems to what clients of the justice system, health system, disability, human services, aged care, what would actually change the trajectory of their lives and make their lives better?
That's a really good question. And from the justice system point of view, just a little anecdote, we did a report on people with acquired brain injury in the prison system that I spoke about, and we set up an acquired brain injury user group. That is, for the first time, we got justice users who have an acquired brain injury, who have been inside the prison system, to tell about their experiences and their needs. And we made a whole range of recommendations to government. Did you know, for instance, that if you have an acquired brain injury, one of the symptoms in many cases is loss of memory, forgetting appointments, you're in prison, you have meds, your meds at a certain time of the day, you forget because of your acquired brain injury to turn up. As a result, you have a psychotic episode. As a result, you're put in a padded cell in prison. As a result, your life in prison becomes hell. Other prisoners, look at you differently and the like. Just little things like that weren't brought to the attention of the authorities. So you need to set up user groups who have had personal experience with the system, whether it's the health system or any other part of our system, but in particular the justice system, because we haven't bothered to listen to the voice of users in the past, because we've had this view, if they're charged with something and they're in jail, they're bad bastards, so who cares what they think? But the reality is that we are warehousing people in our prison system who have mental health issues, acquired brain injury issues, depression issues, drug and alcohol issues, and we're not listening to them and hearing about their needs and redesigning the system accordingly to divert them away from the system.
Sorry, you go, James.
So in some parts of the system we are empowering the consumer to have a voice, so the whole NDIS reforms are based on that, and that's a really complex thing to roll out, but it's a really good proposition to put power into the consumer's hands. And there's also other sorts of ways you can do it. In Aboriginal communities, it's not really that hard to sit down with the community and to discuss what the problems are, and then have that feed into starting to redesign the system, such as in Burke. You only have to visit one or two of these communities and see how simple some of the solutions are, but it won't happen unless you empower the community, and it doesn't have to be an Aboriginal community, it could be a community at Brimbank. So, Ben, to answer your question, I think it helps if you begin to listen and then have structures where you empower the consumer side of the equation. There are lots of ways you can do it.
But there are lots of ways. And we've seen through the NDIS that it is, when you affect system-wide change, that's how you can do it. But it has to be fundamentally based around this preparedness to listen. And I think there's an interesting step that sits behind or underneath that, if I can put it this way, which is there is an attitude for certain groups that you should just take what you get. And ironically, it is the most, in my view, and ironically, I think it's the most disadvantaged groups. So I was listening to Rob thinking, gosh, I wonder how many other people think that listening to the idea that you're a user of the justice system or a user of the prison system, and that by virtue of being a user, you therefore should be listened to, you're entitled to express a view about what your view of the service is. And I actually think that would rub a lot of people up the wrong way. I think they would just think, well, once you're in that situation, you don't deserve it. You don't deserve to have that voice. The reason I bring this up quite directly as that is because implicitly that's what's gone on in Aboriginal policy for so long. And what you get into is this, no one's listening, people design poorly designed programs, they don't deliver the outcomes, they spend more and more money, and then the people who are the recipients of that money somehow become defined as the problem, or part of the reason for why those programs are so ineffective. And it just becomes this really vicious sort of policy cycle that's really difficult to break. We had another question just here.
Hi, Nicola Foxworthy from Common Equity Housing. You've all talked about evidence and outcomes, and I guess from a housing organisation where much of what we do is actually the way in which we might avoid the negative outcomes that come before. I'd like to kind of explore, I guess, the connection between the ability to measure outputs and outcomes and how much of that difficulty, it's a real challenge, I think, in a whole lot of ways, how much of that difficulty is part of the reason why we have such a tough time actually moving towards the outcome.
It's a really good question in the justice sector because I would sit around the cabinet table on a regular basis and there'd be a policy where, let's say, we're going to fund 3,000 extra police, and that'll get us votes, and that's fantastic, and that'll make the community safer. But what was never really thought through was the impact of those 3,000 police downstream. There should be the ability of governments to put a dollar figure on one police officer. Should be half a legal aid officer, half a corrections officer, half a magistrate. No one ever does that. And so, yes, you can fund 3,000 extra police, but the police don't just sit on their backsides eating Dunkin' Donuts. They actually go out and do work and they arrest people, and then that has huge impacts downstream. It's a matter of convincing policymakers and governments to look at a holistic way when you make these commitments. What are the downstream effects, and how do we ensure that those downstream effects are funded appropriately? Otherwise, what happens is justice is delayed and justice is denied. 3,000 extra police officers, more people going before the justice system, but overworked magistrates, overworked corrections officers, no funding from legal aid because too many people are trying to get the same access to the small bucket. It has real implications down the track.
We've got lots of data. We're swimming in huge amounts of data, but a lot of it is not organised, or we don't have the provenance of that data really sorted, so how reliable it can be. So there's lots of data out there. The problem is in connecting outputs to outcomes is that a lot of things are interrelated. So domestic violence and mental health and alcohol and drugs and homelessness and the health system and the justice system, they're all interrelated. Now that doesn't mean we can't solve them, it just means it's complicated. So when you look through all of that, you come back to some really basic things, such as your brain wiring when you're very young, and the absence of having a safe environment to live in, and some other health and dietary sort of things. So we kind of know what a lot of the basic drivers are. What we don't know is often what works to change behaviours. So when we did this big obesity study, what we found was that yes, there's this tsunami of obesity washing over Australia, and it's going to have enormous health effects. But we had very little evidence, particularly local evidence, on what actually worked and what didn't. And so I think that's where we should be focusing. We should be focusing at the granular level of funding proper measurement of things that are likely to work, and we probably have a good idea of things that are likely to work, but let's measure them and just over a reasonable amount of time. And that will give us a lot more granular evidence, but certainly there's lots of data, but connecting it to very specific measures is, I think, what we need to do.
Melina?
I was just going to add, Nicola, that I think this is a lot like the climate change debate. If you don't measure the externalities and the cost of not doing something, then all you see is the cost of doing it. And what James is talking about here in terms of almost like an actuarial approach and seeing ahead of time where you're going to save money by investing, for example, in the restorative justice system. It allows us to take that intergenerational look at models that are going to actually change the system. I think that systemically we have certain structures that work against that. That's partly our electoral and our political system that kind of drives us a short-termism. But I also see in the cooperative and mutual sector that other than the large institutions which can invest in this data analysis, important measuring work, those really important innovations that are happening at the community level are not getting the opportunity to do the measurement, the social impact and other measurement that needs to be done. I think if we could look at funding organisations like your own and other cooperative innovations, for example, that I see the actual organisation itself, which is investing all of its money in doing the thing, to get in on the data stuff as well, we'd start to be able to see if there were some models that should be emulated. We've kind of separated off the research and the data stuff away from the actual, the place-based responses, for example. I think it's often a funding issue, and I don't know how we get over that, but it definitely needs to be done at source. I
think there's a fundamental issue as well around, and I'm talking now around a lot of government programs, of actually asking the question what you're trying to do before you actually start the program. So that's one thing. I actually think that there's way too many things that are done without that fundamental question being seriously asked. And secondly, you'll see in the report there's comments in respect of some of the Indigenous outcomes. Productivity Commission has shown that roughly 34 of 1,000 programs with the tag Indigenous on them are actually evaluated. So if you don't even have a look at what they're doing, it's pretty unsurprising that they're abject failures. So, a question over here.
Oh, hi, my name's Carolyn Wallace from the Social Innovation Research Institute at Swinburne Uni. Just a quick plug, we have a thing called the SODA Lab, which is Social Data Analysis Lab, so it might be a handy resource. My question is really about that scaling up where you do, and you mentioned the Burke example, where you have things that are working well at a place-based level. Any of your tips on how to get that how do you get it to catch on? What's the information, the politics, the processes to really make things catch on at state or national level?
James?
So when things are working really well in the place-based level, when you look at examples, often there's often a single or a number of local leaders that have made it work. Understand their community well, inspiring people who can cross barriers, bring people together, affect change at a local level. Now the problem with that is that's not scalable. So often they uniquely understand their community and they have some quite special sort of skills. So when we're thinking about this, the conclusion we came to was you need to plan to scale. You need to have a backbone that is able to identify what the innovation is and be able to help transfer it from place to place, help scale it. You can't just rely on the original innovation because often there are very unique characteristics around that makes it hard to scale. That's one aspect to it anyway.
Yeah.
I agree with that. You need champions. Like the bottom line in politics, if there's a good idea, you need people to champion it. And if you set up a trial, let's say, the Neighbourhood Justice Centre in Collingwood, for instance, which is a one-stop justice shop, that was set up because I went over to Red Hook and had a look at a model in New York and I thought, my God, this can work here. Why can't it work in Australia? So convinced my colleagues. I think ultimately I only convinced them because, they probably thought it's another, Halsey, lefty, namby-pamby idea. But when I was able to show that for each dollar you invested at the front end, you could save, you know, $1.98 at the back end. Treasury officials thought, oh, saving money, yeah, let's trial it. But to then have more than one neighbourhood justice centre, to go to scale, to have something like that in every community, really takes leadership and champions within the parliamentary system, the cabinet, to achieve that. That's how I found.
So I reckon there's a couple of kind of structural elements, and the challenge is to convince. Ironically, I think you start small because that's how you convince people to have a go. But I think every answer is unique, but they have some core features, I think, which ultimately are, at some point you build a strong and relevant local governance structure. And by that I mean you have a governance structure whereby the community leaders who are taking responsibility for whatever the program is are accountable back to their community and are seen to, the other way in their relationship with government, are seen to actually be a valid voice for their community. Now, each one of those governance structures will look completely different in different places, but there must be some sort of hand on heart. There is a reasonable governance structure. So that's the first thing. The second thing is you have to have a government that's prepared to actually direct funding to that community. So again, in the Aboriginal and Torres Strait Islander space, there's way too little money that actually is directed to Aboriginal organisations. So a lot of it's going to non-Indigenous organisations, and so that's a problem. So you have to at least try to start convincing people to invest directly into the community itself, and that's a risk because they're not used to doing it. So you then have to think about what's your risk management framework. And that's all doable, but it's just a little bit harder than their usual risk management, which is someone sitting at some office in a bureaucracy accounting for every cent that's spent. So there are a couple of things. And then the third or fourth, whatever I'm up to, thing that is absolutely fundamental is that governments and the public sector itself must invest in the capacity of its people to genuinely engage with community, which they do not do on the whole. And I apologise because I am generalising, but they do not do that. And they need to be taught how to do that. And I sort of say that's the third or the fourth point because it's sort of interlinked with how you manage risk. So to me, yes, there's different, but there's some core attributes. And fundamentally, you have to find a way to persuade someone that in whoever's funding it, that they're getting so little bang for their buck that taking a chance doing something a little bit different might be worth doing. And I'll just give you one example. In the UK, they developed a new model for which Australian Unity has brought it here to Australia, so disclaimer there. But they developed a new approach to treating severe anxiety and depression. And this approach was developed actually by a Labor economist and a psychologist. And they worked out that in order to get this new model, and this goes to the health sector as well, how you affect change, they worked out that to get this new model up and running, they could not challenge the system because they would go front and centre into a system that was led by psychiatrists, which was built around large sums of money going to a small group of people. And they realised there was a much broader need. So what they did was set up a little pilot which wouldn't annoy the psychiatrists. They wrote it up. They gave it to every politician as they went on their summer break in the year before an election. And so every political party came back with this nice little pilot, completely affordable, in their policy statements and commitments in the lead up to the election. And then they invested in one little place and it went like topsy, and now it's system-wide. So they were smart. They didn't tackle the whole system. They picked off one thing. The psychiatrists ignored them because they just didn't believe it would succeed. And then it just went like topsy, and then they just published it and publicised it, which is also why we have to talk about these examples again and again.
Just in addition to what you're saying there, Melinda, about the importance of true engagement and governance, good governance, that engagement that happens often at the beginning of the innovation, which is about genuine, not cosmetic co-design with the stakeholders, can often set up the innovation for scalability. And what is often forgotten at the very beginning is what kind of operating model are you putting in place? Is it sustainable to allow, for example, the ongoing access to the trading income or the capital that's required to scale the innovation? And that's one of the reasons why we've seen a lot of social enterprises not scale because of over-reliance, for example, on over-reliance on grant dependency. Just as one example, if I could give one case study of a recent innovation that scaled in the ACT by way of example, because it started with the operating model that has been, it's the same operating model now with 80,000 member owners, as started with a couple of hundred with the first clinic. That's really been the thing that's allowed the scalability. The actual operational model has worked through time. So in the ACT, there's a cooperative called the National Health Cooperative. It actually started as the West Belconnen Health Cooperative with one group of parents trying to work out how to get access to primary health care in an area of the ACT where there were no GPs at all. All they had available to them was the system of Medicare health rebates. They didn't have any other capital available. They had to set up their first clinic that operated sustainably on that system in order to get acute health care for their children who had various ailments like asthma. That's now scaled to 10 clinics with 80,000 patient owners, and their first clinic has gone into New South Wales in Yass. But if you look at the component parts of it, it is the same beginning idea. They didn't get going until they worked out at the very beginning the operational model that would sustain just the one clinic, and that's enabled them to persevere and to grow at a huge rate over the last 7 or so years. So I think there's often a kind of pragmatic element to this that's forgotten, which is actually what are you setting up that will enable it to persist through time? Question here.
Thank you. Sandy Forbes, NAS Group. I've been working a lot with children in out-of-home care and a lot with people who are experiencing homelessness. So there are a couple of comments that you've made, Melinda, particularly, that say what we have is a good safety net. And I'm not sure I'm going to pull all of these threads together, but I'm not sure that Australia does have a good safety net. It has a safety net, but a safety net that is actually suboptimal. And from two perspectives, I've looked at the suboptimal so-called safety net. If families are experiencing financial stress, we're highly punitive. We take their children into out-of-home care. If families are experiencing a lack of safety net and lack of access to affordable housing, we don't do much about that either. So it's not surprising to me that a very large number of people are not connected to the fabulous economic development. So my proposition to the panel would be, what is it, and can in fact government, business, community bury some of the long-standing assumptions and rethink about how they work together around a proper safety net and access to affordable housing? I just look forward to your comments.
I'll start just in terms of it's an absolutely fair comment in terms of the safety net, and I guess in some ways it sort of it draws a it sort of is laser-like in its critique of the sort of broader conversation, which in a sense is sort of what we're trying to unpack with the Connecting People to Progress, which is if you look at aggregate numbers over 27 years, and if you look at the big numbers, we have done some things really, really well. But there are areas where we just consistently fall down. And we called it in the inequality report that we did earlier in the year as well, that this postcode inequality, which I alluded to in the question around the small proportion of postcodes that are just so overrepresented in imprisonment rates and things like that. So I think there are clear areas where we don't do well enough, and the housing piece is one that is coming to the fore. I don't know, I was in Perth last week, but happened to have Sunrise on, and they were talking about a change which I think is being talked about in New South Wales around access to public housing. And if you earn too much, you don't get public housing, and if you don't have a job, you now are likely to get turfed out as well, which kind of left me thinking, I'm not quite sure for who public housing is. So I think it is a really important issue, and one of the things that we're trying to draw out in looking forward is to say, what lessons can we learn from what we haven't done well already, and what are the pressures that are going to build in the future? And funnily enough, housing affordability is one of those. If you have more people who have more insecure work, so if an income is now, if a livable income is now derived through 3 jobs rather than 1, how are you going to go and get access to finance to afford a house to buy yourself, or how are we going to evolve those things? So there's a whole bunch of issues that we think are sort of changing at pace that will probably interact with some of the existing deficiencies. And so they're some of the things that we want to focus on. Where do I think business needs to sit in this space? Business is I think is in an interesting place at the moment. We all know that trust is at an all-time low for business, and particularly large business. One of the things that I've sort of been saying publicly is that I think business needs to demonstrate that it's actually hearing what community concerns are and what community expectations are, and that they're actually demonstrably responding to those things. One of the ways that you can actually do that as a business is by becoming involved in place-based solutions. And I've had something to do with a few larger businesses that have done this, and the really interesting thing is that when their people become directly involved in these community projects, they learn firsthand what the community expectations are of their business. But they also learn so much more about how they engage with people, how you have a genuinely inclusive model. And when you bring that back into the workplace, it actually transforms workplaces. So I see it as a real win-win because you're part of a solution in a community, but also somewhat unintentionally perhaps you transform your workplace so that when you're talking about diversity and inclusion, you're actually achieving it because you've now got champions who've experienced what it can deliver in terms of huge innovation and benefits. So I think there's a huge opportunity for business. I think it's absolutely needed, particularly in the most wicked areas of social policy, because the ways that we've been progressing these things in the past just haven't worked. And so we must get people to think differently. And I think putting people together in unusual combinations is how you do that.
Look, is our safety net perfect? No, by no means is our safety net perfect, but it's not the worst in the world either. If you look at one of the issues we have to balance is that we've traditionally had very targeted services in Australia and not universal services, and that's a good thing because it makes the whole system more affordable, that we tend to provide services to those in need rather than just generally to the public, and that's really good for sustainability. But people do fall through the cracks. There's absolutely no doubt about that. Having a focus, as we've said in a lot of the work we've done around the person and the journey of the person, really helps in thinking through what services they should have at a certain point in their lifespan. And I think that's the approach we should take to a safety net, is following the path of the person and being person or citizen-centric and identifying the gaps from that point of view. From an affordable housing point of view, if you don't have a stable place to live, how can you do anything else in your life? So whether it be social housing or affordable housing, just having certainty about a safe, viable place to live is really, really important. But there are more important elements too. If we're going to truly address these few postcodes, I think we need to look at where we put affordable housing. It needs to be put near jobs, not way out on the fringe of the city. And if we're going to be putting it near jobs, it should also be near transport and services. And that means we probably have to consider greater density. We have to consider planning changes. We have to consider new models like build to rent. So there's a lot of things we can do in the design of our cities that can help address that disadvantage, particularly from a housing point of view.
We've probably got time for one more question, if there is one more question. Otherwise, I'm standing between dessert and our panellists. Well, thank you.
Could I just make one
Sorry,
last
James,
comment? We've kind of talked a bit about the negatives in many respects today, and I didn't want to leave without saying what the positives are. And the positives are we have this growing economy. We have one of the highest median wealth in the whole world. Our wealth is more evenly distributed. We have pretty good prospects for the future because of where we are and how we've invested in skills in our population. We do have some challenges, but I think almost every country in the world would swap for our position. And these challenges we're talking about, they're not insurmountable at all. And I think there's a lot we could actually do in the next decade or two to make very significant changes. So I just wanted to finish with a positive note. I think there's a lot to be actually very optimistic about.
And after the recent election, we're told that we have the most progressive government and we live in the most progressive state. That's good.
Well, thank you, Rob. Melina, go.
Woman's got to have the last word. So on a positive note, I think, so Melinda said earlier that 5%, despite this growth, 5% of the Australians surveyed think that they can't connect to that economic progress in their own lives. That means that growth is not enough, or it hasn't been enough. So the challenge for us, the positive challenge for us as a society is how can that be felt more equitably? And that seems to be around this intersection of community, of business, of government, of institutions that you've been talking about in the report. And I guess allowing ourselves as a community to allow that entrepreneurialism to rise up from different sources. It's very important we have a social safety net. People are still feeling that the risks and rewards of the economy are not shared equitably, and there are different sources of innovation and response to that exist in addition to government, but also in those other areas of the economy and the community itself, in particular, that really need to be encouraged to come forth.
So James, I couldn't have scripted that better, because in fact what I was about to close with was to say that one of the things that we really were trying to do with the Connecting People with Progress was be exactly that, which is optimistic. So at a time when people have been sort of talking about all of the challenges, about the challenges of automation and technology and our place in the world and all the rest of it, really one of the things we wanted to do by looking back was actually to say, if you had looked at where we were in the early 80s, you would have been wringing your hands. We fixed our future then. And we honestly believe that we can fix our future in the way that we've all been talking about again, and that we should be optimistic about that. And that is very much what CEDA's tone is, if I can put it that way, and our attitude towards this reform agenda is that if we tackle the tough issues and if we do it collaboratively, then there is nothing other than an optimistic future for our country. And I have to say, when I looked through the report again and saw the wonderful contributions that we had across the board, from heads of unions, from CEOs of the biggest businesses, from people like James and Melina and people on smart justice, and if you listen to this conversation, the positive that I take from it is that there are so many people who are just so keen to embrace this sort of agenda that I think there is a tremendous opportunity in the future, and I'm very much looking forward to it. So thank you to the three of you for being part of today's conversation. If you could join me in thanking them. And I'm not standing up because anyone who's been to a CEDA event knows that the last thing I must do is spruik the next CEDA event. And this time I don't require any sort of bribe to do so, because this Friday we've got Mariana Mazzucato on stage. Anyone who's been in the office at CEDA in Victoria knows that I am a #1 fangirl. She's out here promoting her book, which is all about value, who creates it and who doesn't. And it's a real challenge to thinking around people that will argue that they've created tremendous value and questioning whether they are the ones who really create what is valuable in our society and our economy. So if you haven't booked and you have the chance, please do so. If not, I should probably spruik a book because I think it's worth reading. And if we don't see you on Friday, please enjoy the holiday season, and I look forward to seeing you in the new year. Thank you very much.